Welcome back, everybody, and thanks so much for tuning in today, our second day of ChiroThon. And honestly, Sherry, I couldn't be more excited because we're here live in the beautiful Atlantic City, New Jersey, at the Association of New Jersey of Chiropractors annual conference, and we're having a tremendous good time.
We're having a great time. You can probably hear the music. It's exciting.
It's a
to
party!
Be here. I wish you were here live with us because we are having a lot of fun. And Fab, you know what's exciting about being in Atlantic City? Cha-ching, you make the money. So that's where you gotta be. You gotta be the places where we can make a difference in the world. So being on the ground in New Jersey at Harrah's is a fun place to be. And we wouldn't have been able to do any of this without your amazing support. So this next vignette is really one of the best because it is showcasing the opportunities that your body needs when it's suffering and to alleviate some pain. But we have the Foot Levelers, the world's leading provider of handcrafted, custom-made flexible orthotics. They're sponsoring this segment and they've been around since 1952. They have a custom-made orthotic that is uniquely designed to support 3 arches of your foot. It offers the whole body support. They promote optimal alignment, which is something we often talk about, and while providing the balanced, symmetrical foundation that makes us happy. So if you want to learn more about Foot Levelers, you can go to footlevelers.com and learn more about what they do and why they do it on Facebook, Instagram, X, and LinkedIn. Let's see more.
Foot Levelers offers a wide range of custom orthotic solutions tailored to unique patient needs, from everyday support to options designed for sports and an active lifestyle. Our cutting-edge scanning technology and educational tool, the PostureCheck 3D, empowers healthcare providers to assess posture and biomechanics efficiently, enhancing patient understanding and engagement. Learn more at footlevelers.com and follow us on social to stay up to date on the latest innovations and insights in custom orthotics.
Thank you. Well, we're excited to welcome Dr. Christine Foss. Dr. Christine is a highly accomplished sports medicine expert with a master's degree in sports medicine from Old Dominion. She's a DC from New York Chiropractic College, an MD from UHS, a certified athletic trainer, and a diplomate of ACBSP and ACRB. She was named 2020 ACA Sports Chiropractor of the Year and 2023 Fix Educator of the Year. She's also the author of Dissecting Sports Injuries of the Hip. She owns Elite Sports Recovery Center in Florida and has treated many elite athletes at Notre Dame, Olympic training camps, World Games, and Team USA TF. An international lecturer, she directs the Northeast Chiropractic College CCSP program and serves as Foot Levelers Director of Education. It is such a pleasure to have you here. You're a legend in chiropractic, and I know we're going to have a great conversation.
Well, because she's so talented and she's been to so many places, I think this is one of the reasons why we're truly blessed at ChiroThon is to have guests like you come in and knowing the plethora of people you've seen, some of the things that you knew in your heart could have been prevented when you see these types of injuries in athletes, especially the gymnasts, because they're, I know, one of your special loved patients.
Yeah.
I would want to ask you, what are some of the things that you have seen over the period of time that really is low back pain related that you wish perhaps patients knew about before it's too late?
Mm-hmm. Yeah. I would say, really making sure that we look at the whole body instead of just the low back. That's kind of my mission now. If we look at movement and performance, we've got to just know that the back pain sometimes is a situational complex from another area, whether it's faulty foot biomechanics or hip biomechanics, but chiropractors are so good at looking at the whole body and moving away from myopically looking at one region and just looking at everything is where we rule. So I would say that would be the one thing, is just step back and look at the whole human frame.
When I see the statistics of low back pain as the #1 disability, when I see so many people struggling with chronic back pain, you often wonder, most of the time we just think that it may be just our bad posture. But as chiropractors, we know that that is not so. There are many attributes. So what would you say will be maybe some of the things that people need to look into that could be contributing to somebody's back pain?
Yeah, that's actually really interesting. I was just in Copenhagen at the WFC and had breakfast with one of the top researchers, Scott Haldeman. You might have heard of Dr. Haldeman. And his interesting perspective is he thinks that back pain is, really a metabolic issue now. We need to think about, as we talk about back pain, again, we need to go outside and look at the inflammatory cascade. What else is going on in the body? Do they have metabolic syndrome or diabetes? We see those incidents dramatically increase on our low back patients. So again, as portal of entry doctors, we need to consider beyond back pain.
Beyond back pain. You know why I love having you here is because that is your focus, is beyond back pain. And it's kind of an interesting conversation because we look at where the number one disability in the entire world is low back pain. And yet I often contemplate this very important piece, which is back pain is a symptom and also a diagnosis.
Yeah.
And so when we think about a symptom being a diagnosis, it means something that Dr. Haldeman just said, which is we need to dig deeper because we can't use a symptom as a diagnosis without being effective. And one of the things that you have been so good at in expert education is connecting the pieces. Like you literally, it's like a jigsaw puzzle for patients. It's like, well, I have an organ here, it's a liver here, it's a foot there, it's a hip here. We need a doctor who can really bring this jigsaw puzzle, an architect, to take them where they want to go. And let's talk about the foot because that's one piece. When we look at how our feet impact our lives, unfortunately, the feet often become kind of like the ugly stepchild.
Yeah.
It's like
So
we don't give them the love. We walk on them all day long, and yet they do actually have a big impact on our back health. But I don't know if all of our listeners, especially some of the consumers, ever really contemplate your feet can impact your back. Talk about that.
That connection is huge. And now with new research, we really see that the foot-spine connection is not a fictitious, Jurassic Park beast. It is real. We know now from research when someone has ankle instability, they're more likely to have an ACL tear in their knee. When they have hyperpronation, they're going to have hyperextension of their back and actually load their posterior elements. So if we're not looking at the foot as that foundation for back pain, remediation, we're really missing a mark there.
There's many chiropractors that have been trained to understand the value of the feet, the posture. I don't go anywhere without my custom orthotics because they just have made my life so much better over the last 38 years. But you have a very interesting background, especially when it comes to treating elite athletes. And I think a lot of times, an individual may be looking at them and saying, well, they're so built up and they don't have the same kind of problems that we have. Maybe they're not as having the challenges of weight gain or obesity that some of the other ones. What have you learned about what are some of the maybe 2 or 3 top behaviors that elite athletes use in order to maintain their body and prevent back pain?
Yeah, that's such a great point. What I've really learned, the first thing is elite athletes are not unlike every other patient we see, just a different level. But what they're good at is listening to direction and doing their home exercise plan, which we know that a lot of our patients don't do, but they're ready and willing to do anything to be better for excellence. And so, we can do that in many different interventions, whether we're putting insoles in to unwind the kinetic chain or decrease load, or whether we're giving them home exercise plans. But I think the behavior is they step up, And so I think that that's something that if we could just infuse that into more of our everyday patients, we'd probably see a more dramatic change in back pain.
That's a beautiful thing to say, diffusion. We contemplated earlier this morning when we started talking about that self-love, the looking in the mirror and seeing what it means to be the best we can be. And then you said diffuse that into taking action. Action is critical. And I want to reflect on just a moment historically. To be great means to do great. And Jack LaLanne actually said, if you want to be great, you have to start to be great. What is it going to look like to do better, have better, and be better today? Today, we want to get you aware of that your foot and your back are together,
Right.
and to really truly heal, whether you're a professional athlete or not,
Right.
to really truly heal or prevent. Custom orthotics is preventing for you. Custom orthotics is preventing for me and you.
Me too.
So we're here today to say we're taking action because we know that our back deserves better. Tell me about some of the action plans. Like a lot of people will say, oh, walking's not really exercise. Tell me about walking. Is that really exercise?
It's huge.
Tell us more.
It's huge. So actually some interesting research. I know I'm deep in the research, but if you walk 30 to 45 minutes a day, your chance of neurodevelopmental disorders, Alzheimer's, dementia, dramatically decreases. So we're seeing these changes with just walking. So if we can get our patients comfortable with their gait and walking, imagine metabolically what we're doing. If we can talk about diabetes, which is just a pandemic in our world and ever growing and continues to grow. If we can get our people moving, if they walk 1 block after a meal, they decrease their blood sugar more effective than their diabetes medication. So walking is absolutely critical. So looking at that foundational component of walking and making people comfortable with their gait is actually more effective as a portal of entry doctor than almost anything else that we can do.
That's brilliant because you know that's part of the diabetes, hypertension,
Yep.
cardiovascular, and not to leave out. There's 4 of them. You start thinking about diabetes, hypertension, cardiovascular, and obesity. All are fundamental opportunities for your body to be unwell. And when you just talked about feet, back, and movement, if you can understand and appreciate that movement changes your metabolic outcome,
Huge.
it's critical, isn't
You
it?
know, to me, I still find it very interesting how we've come so much full circle. For so many years, we have been conditioned to think that the answer is in some kind of pill or some kind of procedure. But in reality, many of our lifestyle behaviors are the ones that really are lacking and that are contributing the most, according to the new science, to many of these conditions that people are going through. So the importance of walking, I think, is fantastic. I wanted to ask you a 2-part question. The first one is, as you know, I think the majority of the population is expected to have back pain at one point of their life. So what would you say is the number 1 myth, based on your experience, about back pain that people should be aware of? That is a myth. And the other one, if there was one thing that you've learned in all your education, skill, experience, that people can maybe consider doing, one thing that can improve their back pain immediately, what would it be?
Those are 2, you're putting me to good questions today. The myth, I think first, is that you don't have to live with back pain. And I think so many patients now just come in and they've had it for years and maybe they haven't had a chance to find the right practitioner, have the right intervention, but they have to play an active role in getting better. And that's what we were alluding to. And then I think the second question was about the intervention, am I right?
What would be one thing that people can consider doing based on your experience? Maybe one thing you teach people to do. If there's one thing I can do right now to get me started in this path towards reducing my back pain, what would it be that you found to be effective?
I obsess over one word all the time, and if I was going to open an office today, I would name it this: move.
Wow.
Just move. You know, it's so simple, really.
I love it.
It is. And
So simple.
we kind of get to this place where we do have to discipline ourselves. And when discipline is voluntary, it sticks.
Yeah.
Because I can't say, Fab, you've got to walk 3 miles a day.
Yeah.
That's your homework. And you think to yourself, when am I going to find time? How am I going to do that? You negate that special part in your brain called the habenula, and it says, no, that could hurt us. We're not going to do that. There's something that holds us back from that discipline. And voluntary discipline is greatness. And when we do the movement, it changes everything. It increases your oxygen. It increases the blood flow.
Huge.
It increases your cognitive awareness, your body on the ground. And I love that you say move, because one of the pieces that I think we can connect with is having the time for you. If anything, if you can find the time to just allow yourself, maybe you connect with some favorite thing in your life, and you like a podcast, like Adjusted Reality, and you want to move.
Yeah.
Could you move in the morning while you listen to Dr. Fab Mancini on Adjusted Reality, or Dr.
Love
Christine
it. I love
Foss?
it.
This is one of the pieces that I think really makes a difference, is combining what you love with what you know you need to do, which is discipline. You know, we know what discipline is, and I love that we create a momentum, because once you start moving, hopefully it'll
It grows.
keep moving it through. So as you do your life as both fit yourself and finding fitness in your Olympic athletes with treating a whole being approach, what are some of the fun things that you do to connect those dots?
Yeah, that's a really good question. So my day always begins at about 5:30. I go to the gym. I think you have to get your mind set first, and that begins with movement, whatever that is for you. For me, it's lifting. And then I do red light therapy, antioxidant, metabolic turnover, red light therapy.
Love it. Love it.
Then a meditation, 10 minutes of meditation. Then I'm ready for my patients to give them my everything for the day, and pulling that together with expecting my patients to give something back. You know, so if I'm willing to do that to get ready to see them for the day and give them my everything, then they have to be a contributing force. We have to be a team in getting better.
I like that you wake up and don't even think about it, because that, to me, that's my, if I don't have to think about it, it's the first thing I do.
Right.
Is you just do it. You
just
get
gotta do it.
into that habitual, because you know that is what sets a habit, is you become habitual in knowing this is just what I'm going to do. And I like that you kind of adopt that routine to be prepared for the rest of the world.
Yeah.
Isn't that a beautiful thing when you're sitting there today and you're thinking, how do I show up strong? And if you're listening and you're dealing with back pain, you know, what are you going to do to make yourself feel better? How are you going to make the choices today? And I think that's what you're saying, is that's part of your responsibility, the ability to respond to the things that you need when you need it, and finding chiropractic, because you're there for them.
Right.
You're going to take them where they are to where they want to go. Tell us, when you meet that patient and they need to go somewhere and you know where they need to go, sometimes they're not ready. How do you deal with that?
Yeah, that's such a great question. Through the decades that I've been in chiropractic, I think really spending time on that initial exam to find out, I ask every patient what their goals are, because my goals are usually this, but maybe their goals are not that.
Yes.
So aligning goals with my patient and then walking them on the journey together. You know, I think patient education is everything, but I can get you here, but let's start with, you know, this step first, and then we're going to reevaluate that. And I think pulling them along. You know, some patients that have been to many different types of doctors maybe don't believe they can get better. That's an important part. I mean, there's a psychological weight that's left behind with every physical injury. So us as portal of entry doctors, we need to be ready to handle both ends of injury. You know, the psychological component as well as the physical component. And then bring the patients with us on our journey to get them better.
I think it's so great that you mentioned the importance of not only a good history in the beginning, to spend that quality time with the patients, because I have one thing in my practice that actually made all the difference in the world, and that is I asked the patients what were the 3 things they value the most. That's one of my key questions.
Huge.
And I knew that for me to be a good communicator, I had to relate those 3 things to my message or my service. So that changed everything in my practice, because I knew every patient will see my service as a chiropractor as a valuable thing, whether it was their family, their careers, their finances, their faith, a lot of times. I had to relate chiropractic to those things. But you also mentioned the fact that, you know, in chiropractic, many people view chiropractors as a back pain profession. And I never entered this profession because of back pain. I entered it because I felt that we were the first line of defense. We were the most holistic, preventative, educated doctor that will look at the root causes, evaluate their lifestyle, give them treatments like chiropractic care, which are very holistic, very safe, very gentle, and then begin to work with them, engage them, so they can take responsibility for their health. What do you feel is the one thing that you feel holds people back from truly engaging in care in your experience?
That's such a great question. I think it's fear. You know, whatever public perception they might have or historically, or bad experiences they might have, not believing they can get better, or whatever a friend told us about them improving. But you know, for me, I think if a patient comes to your office, they're giving you their 3 greatest commodities on this planet, and that's their time, their health, and their money. And so we need to be worthy of that. And whether that's you being excellent and starting your day, for me, my frame of mind's got to be excellent, because if your patient's giving me that, I have to be worthy of that. And so, you know, I think that we just need to kind of pull this all together, but I love what are your 3 most important things? I think that that's really impactful to get your goals aligned with theirs.
Well, you mentioned goals, and that's what made me think of it, because I have found that most of my patients' goals are very low. They don't think they're going to get better. They've been told they're going to have to learn to live with this, especially back pain. They have not seen many of their friends get over their back pain, so they don't have a lot of point of references like we do. We get to see that healing every day.
Right.
That's true.
They don't. So I love when you said, I want to make sure that I hear what their goals are and then be able to bring them to what is possible.
That's the 60,000 foot view that I think, Fab, you do such a fabulous job. And having an expert who's really into the biomechanical neuromuscular skull system. Yes, that's a word for Saturday. That's your big word.
That's a long word.
Here's what I think is so beautiful is Dr. Foss comes looking at the feet, but it's also the back and the whole being perspective. I want to talk about feet for just a second, because I think feet, they get the bad rap. They don't get as much love as an attention as they do. 26 bones in the feet. Bless you.
God bless.
Can you just share a little bit about the anatomy so that you guys start to think about the feet in a different perspective when you take that next step, not away from ChiroThon today, but towards ChiroThon? When you take that next step with those 26 bones, share a little bit about the anatomy and why is the foot so intricate?
Yeah, it's really important. 26 bones, 33 joints. And in order to have a normal motion, a normal gait, anything else to happen above that well or normally, all those joints need to be working. And so we think about the anatomical structure and, you know, all those bones, they all need to come to play in a perfect position, which is really difficult, which is why insoles are helpful, because they help realign the foot and get us, you know, so that everything else up the kinetic chain can start working properly. You know, so I think, you know, owning that anatomy and understand not only do we have the joints, but we have the tendons, the ligaments, the muscles, everything's got to be on par for one step to be normal. You know, so, and that's just in light of different terrains or different footwear or women wearing high heel pretty shoes, you know, or what have you.
26 bones. Did you hear that?
Right.
33 joints. That's a lot, don't
a
you
lot.
think?
Well, it's so interesting because it makes me want to go back to school when I first started learning about the importance of the function of your feet, but also the weight bearing. A lot of people don't take for granted that many of us are carrying a lot more weight than we need to. And all of that is tax actually goes into your feet.
Your foot.
So it begins there. And if you don't have a strong foundation, then that foot unfortunately can turn into not only a lack of function, but also a lack of structure. Meaning something above the feet is going to struggle, whether it's your pelvis, whether it's your spine, whether it's even your neck. And many times we have been able to find that the source of the neck problem was never in the neck, actually was in the feet.
100%.
And it makes all the difference in the world.
Yeah.
But I think as an individual, we just need to be curious, we need to be aware, and we need to use our common sense, because a lot of this is common sense, but unfortunately, that's rare nowadays.
Right.
Okay, last word on the foot today, because I think our audience is probably waking up to the fact that I don't give my feet that much love.
Right.
What would you say to them?
Please make sure that you not only develop foot strength, because we think about our back patients, we know that chronic low back patients have very poor balance. Balance is a $50 billion liability for Medicare a year. That's $50 billion for people with falls a year. So when we have poor foot strength, Guess what? That's very, very closely correlated to low back. So if you have a stenotic patient and pressure on the nerves, we lose strength in the feet, we lose balance and coordination. And so, I really think if you're going to do something today, move, which is my word of the day.
Yes.
Get those feet nice and strong. Make sure you have good solid footwear and a flexible insole if you're going to have an insole, not a hard insole that's going to kind of cast the area. We want all those bones, 26 bones, 33 joints moving. And that's all about movement.
That is a beautiful way to end our segment, and I think movement is the key. So we first want to thank you, Dr. Foss,
my pleasure.
because you come, Dr. Foss, with the wisdom, the knowledge, and the care. You care about your patients and make them aware. But we also want to thank our viewers today because we've been enjoying these vignettes, probably, hopefully, more than you. It's just been fun to just have these conversations and have these great, incredible guests.
Well, I got to tell you, is every time we have an interview like this, I feel so inspired and so grateful to be in this profession.
Yeah.
Because it makes me recognize the true value that we bring. And that's why it's so important for you to stay with us, for you to be able to share this link with as many people as you can, because together we can change the world. And we have the ability to help people find whole well-being care and spread the awareness of chiropractic and the value of chiropractic. And if you've been inspired by this vignette, I want you to please go to f4cp.org/ChiroThon, f4cp.org/ChiroThon to make a donation. Every contribution that you make, whether it's big or small, we have students that are actually donating while we're here. We have chiropractic assistants that have been donating. I'm so proud of them because we love them and we cannot do what we do without them. We also have chiropractors that have really stepped up, and I want to thank you for that. And Sherry, I hear that we have a new update, so I'm going to do the drum roll.
It's coming together, and it's Saturday, and it's the morning, so we're just ramping up. And remember, we're going to be back here this afternoon, but we have a fabulous update. $21,050 has been raised in a day and a half. It's because you care to help us move the needle and the message across the world on what the benefits of chiropractic is. So we want to thank you for tuning in. Listen, we're going to be right back at noon for our next vignette. So please stick around with those 26 bones in your feet and 33 joints. Okay, we'll see you soon.
Foot Levelers offers a wide range of custom orthotic solutions tailored to unique patient needs, from everyday support to options designed for sports and an active lifestyle. Our cutting-edge scanning technology and educational tool, the PostureCheck 3D, empowers healthcare providers to assess posture and biomechanics efficiently, enhancing patient understanding and engagement. Learn more at footlevelers.com and follow us on social to stay up to date on the latest innovations and insights in custom orthotics.